All right, team, welcome to the latest episode of the AdhereTalk podcast. With today's my friend, colleague, Dr. Roger McIntyre. So welcome, Roger.
Jerry, good to be with you, and this is going to be a lot of fun. I look forward to this topic.
Thank you, Roger. Hey, so today we're going to talk about circadian rhythms. And, it's important, I think, for us as a psychiatrist, how do circadian rhythms play a role in our practices? Roger, just as a general topic, and what is it, by the way?
Yeah, Jerry, when I started off my career, I thought to myself, I want to dedicate my career to the study of depression and bipolar disorder. And then what I
Mm-hmm.
quickly learned was that the nucleus of depression and bipolar disorder is circadian in
Yeah.
many, many cases. And then I
Mm-hmm.
subsequently learned that the nucleus of many, if not most mental disorders has something to do with circadian. And, it's interesting because millions of years of evolution have produced quite an impressive product called the circadian rhythm or the internal pacemaker. And it affects every aspect of our existence, our behavior, our cognition, our physiology. No surprise, if it didn't, we wouldn't have adapted, our genes wouldn't have been responding, wouldn't have survived. So it's no wonder that we have over half of our genes in the genomic sequence for human beings that actually exhibit circadian rhythms. It is central to everything. And certainly as someone who works in the area of depression and bipolar disorder, it has been a defining characteristic of those illnesses.
Right. And so how does it play a role, say, in our management of mood disorders or even in ADHD, Roger?
Yeah, I think that it begins with epidemiology. Everybody knows that sleep impairment, which is a manifestation of circadian disturbance. To be clear,
Hmm.
circadian, we're speaking to the biological systems, and the biologic systems are exhibited phenotypically, either in the form of a biomarker or a behavior. So sleep is a behavioral manifestation. And as I see it and as I categorize it, circadian disturbances writ large are playing a role in the risk for many mental disorders. They play a role in the progression of mental disorders, and they play a role in the response to treatment. So incidence, progression, and response to treatment. You pick the mental disorder, it's there. The other part, Jerry, and you and I know this from clinical experience, is that most of our patients also who are living with serious mental illness have many medical problems, such as obesity and diabetes and
Hmm.
heart disease. And these aspects are also related to circadian dysregulation. So I would say that the Venn diagram of the modal psychiatric patient, yes, we have the mental disorder at the center, but it's embroidered with many other psychiatric problems and medical problems. And I think that the way I would see it is that circadian plays a role in risk progression and response to treatment. I think this is, by the way, in many ways, alerted folks in the highest echelons of science. As you know, Jerry, back in 2017, Hall, Young, and Rosbash were given the Nobel Prize in medicine and physiology for discovering the genetics, the molecular basis of the circadian system. So certainly, I think the circadian system was instantiated, I think, to the highest levels by the NIH with the RDoC criteria, but now it's won the Nobel Prize. So I think that
Yeah.
tells us it's prime time with respect to scientific scrutiny.